Hello, my name is Jessica Herrero. I am in PBH 205, section 1028, and I chose diabetes as my final research topic. There are different types of diabetes, such as prediabetes, gestational diabetes, type 1 diabetes, and type 2 diabetes. There are different types of diabetes, as I mentioned before, that can occur. This is depending on lifestyle or genetics sometimes. It's a medical condition that requires maintaining a healthy lifestyle in order to keep it under control. Diabetes has become more of a social norm in the United States, but it does not take away from the fact that it is a deadly medical condition that has been the cause of thousands of deaths. As we can see in this diagram, it'll help us to understand the different types of diabetes in the oncoming slides. But the keys represent insulin, the small white dots represent glucose, and the insulin is represented as a key because it lets glucose go into the cell, and the glucose goes into the cell in order to give energy. Type 1 diabetes is mostly diagnosed in children because it is an autoimmune reaction where one's body does not produce insulin. Without the production of insulin, one's body would have excess glucose. Therefore, insulin must be administered every day in order to keep the levels mediated and normal. This type of diabetes isn't the most common since it's most prevalent in the younger generations and in kids, but it is equally important to keep control of. This diagram explains a little bit more about type 1 diabetes and the insulin deficiency. The little white dots represent the glucose in the bloodstream, where glucose cannot get into the cells without insulin due to the lack of insulin in the body. Type 2 diabetes is when one's body doesn't use insulin well enough in order to keep our glucose levels under control. This is the most common type of diabetes that affects adults. Around 90 to 95% of people that suffer from this type of diabetes usually develop it later on in life. And although it's the most common type of diabetes, it is a lot more manageable because it can be controlled through healthy habits such as lifestyle changes that include changing the way you eat or maybe increasing fitness habits. And in this diagram, we can see some insulin resistance. So with the blue one, we see where the insulin tries to let glucose into the cell but is unable to. And the number green 2 shows how some cells cannot get enough glucose to use for energy. This makes glucose stay in the blood, causing blood glucose to be above target range. And then this would call for medications such as insulin or other medications that a provider might prescribe in order to control this. The two other less common types of diabetes are gestational diabetes and prediabetes. Gestational diabetes is more of a temporary type of diabetes. It is developed during pregnancy in women, but usually resolves itself by the end of the pregnancy. What this means for the mother and the child in the womb is that there's an increase of chances that they will both get type 2 diabetes later on in life, and their overall health issues would also be a lot more probable. In this diagram, we can see how high blood glucose levels in a pregnant mother bring extra glucose to the baby in the womb, and therefore can cause the baby to put on extra weight. The other type of diabetes would be prediabetes, which is also common, but it is less common to know the symptoms of because they're not as obvious. Having prediabetes means that the blood sugar levels in a patient are higher than normal, but not high enough to be qualified as type 2 diabetes. Similarly to type 2 diabetes, though, prediabetes can be reversed through lifestyle changes, according to the CDC. Diabetes is important to watch out for because it can lead to other conditions. This can include administration of insulin regularly or permanent lifestyle changes such as eating habits or workout routines. And although diabetes is preventable, it is quite common, and therefore it is more important to attempt to prevent it. In addition, diabetes can lead to other diseases such as heart disease, kidney disease, or vision loss, which also highlights the importance of its prevention and treatment. So for some statistics on diabetes, here we have a graph showing diabetes in the United States, where 37.3 million people have diabetes, which equals to about 1 in every 10 people, and 1 in 5 people don't know that they have diabetes. As researched by Guys et al., there was a potential plateau in the diabetes epidemic, yet in the Hispanic and non-Hispanic Black communities, incidence continued to grow, as well as with those who obtain a high school education or less. Debshande et al. Also conducted research on epidemiology of diabetes, and they discovered the age-adjusted prevalence rate for diagnosed diabetes was highest among African American women, sitting at around 8.3%, and the lowest was 5.4% in white men. The mortality rate of diabetes in 2002, according to Debshande et al., was so great that diabetes became the 6th leading cause of death. Not only did it become the 6th leading cause of death, but in around 200,000 other deaths, diabetes was listed as a contributor. It was also found a high prevalence of type 2 diabetes and prediabetes in the adult offspring of women with gestational diabetes, therefore further proving that an unhealthy lifestyle could lead to a vicious cycle where diabetes becomes a burden in one's life. Some primary preventions of diabetes include maintaining a healthy lifestyle. Scholes and Hu, in their annual review of public health, discuss how maintaining healthy body weight and avoiding weight gain during adulthood is a major step to preventing diabetes, which can be done through healthy diets and regular exercise. They also recommended decreasing the consumption of alcohol and sedentary behaviors such as smoking to almost eliminate type 2 diabetes. These behaviors could also be applied as a secondary prevention in order to reverse prediabetes, since those individuals are borderline diabetic. Tertiary prevention of diabetes includes administering insulin as directed by one's medical provider, as we can see here, or any other medications that may have been prescribed. There are public health programs such as the National Diabetes Prevention Program or the National NDP that partner up with different organizations to prevent or delay type 2 diabetes. There are resources on the CDC website regarding how to receive help, information, and about the disease itself, and most importantly, other prevention methods. In addition, there's a test called Could You Have Diabetes to decide whether you may be pre-diabetic. Resources such like these are ways which public health allow for population to feel more supported through their illnesses and diseases. To alleviate mortality rates caused by such a prominent disease, especially in America, these resources are crucial to spread valuable information for all to learn. And these are my resources. Thank you.